A Fraser Health doctor is speaking out about violent attacks and even preventable deaths in the emergency rooms where she works. We brought you the story earlier this week. Caitlin Stockton filed a lawsuit claiming her job was threatened after she put up a sign warning patients of ER delays at Eagle Ridge Hospital. She sat down with CBC to talk about why she's going public, including whether she's afraid it might cause her more trouble with her bosses.
Absolutely. Of course I am. They threatened to fire me for putting a sign up, so I can't imagine what's going to happen for speaking to CBC about this. But I'm more fearful that our emergency rooms, which are the safety net of our healthcare system, are failing, and that patients are falling through the cracks and are going to continue to fall through the cracks unless something changes.
That was Dr. Caitlin Stockton. CBC investigative reporter Michelle Gassou broke that story here on the earlier edition earlier this week. Since then, she has been receiving calls and emails from you about your own experiences with the ER. Good morning, Michelle.
Good morning.
Okay, so this story obviously hit a nerve with the audience. What are they telling you?
Yeah, we received dozens and dozens of emails from nurses, from doctors, a ton of emails from patients here in BC and right across Canada. And I should say that what people described won't be entirely surprising to anyone who's been to an ER recently. These aren't accounts of things going horribly wrong medically, but they're cases of regular people who ended up needing to go to an ER and came face to face with the system that they said appeared to be not working. So when they heard Dr. Stockton's account earlier in the week, they wanted to share their own perspective. Now, one woman I spoke with was Angie Dubé, and she said she actually felt validated when she read the story because she had an experience at Royal Columbian Hospital, which is one of the hospitals that Dr. Stockton works at. So back in February, she had an emergency C-section. And then a couple days later, she started having some symptoms like shortness of breath and heart palpitations. So her midwife advised her to go to the ER. So she goes to Royal Columbian and she said, she knew that she was going to have to wait. But when she got there, it was just absolutely packed. And she had a really vivid description of what she experienced.
We were in the main waiting room of RCH and eventually got moved to like a hallway where there was just more plastic chairs and then people lined up. And there was patients getting wheeled back and forth on stretchers and hospital beds, and people just lining this hallway and almost getting knocked over by people walking through and having to say like back up, but there was nowhere else for people to go, and where people were just coming in and getting like IV infusions right out in the open. There was no end to it. Like literally if someone had been like, oh yeah, you've been transported to hell, I would have been like, yes, this makes sense that I'm stuck in this plastic chair with no way to be comfortable for 17 hours with no answers and feeling like nervous and scared for what might be wrong with me.
This was just after having a baby.
Mm-hmm.
How long did it finally take her to see the doctor?
So yeah, 17 hours all in all. And, she'd had an emergency C-section just 2 days earlier. So she said it was actually very uncomfortable to be sitting upright in a plastic chair. And she says by the end of this, she was so emotional by the time she actually saw a doctor that she just burst into tears.
When I finally saw her walk up, it was just like, I'm going to get answers. I'm going to get to go home. And it was just everything. And she was like, oh my gosh, I don't know if anyone's ever been this happy to see me before. And I was like, I just want answers and I want to go home. Like so emotional and so tired and just feeling like our system is so broken. They couldn't tell if my legs were swollen simply because of the medical condition that I was experiencing or if it was because I had been sitting there for so long.
And she's talking about the situation at Royal Columbian where Dr. Caitlin Stockton works. Did you hear about other places?
Yeah, I heard from a man named Rob in Surrey, and back in May, he separated his left shoulder. It was the fourth time this happened to him. He went to Surrey Memorial Hospital at around midnight, and he was finally seen at 9 a.m., so he was sitting there all night. But he said once he finally got to see a doctor, the staff there were just awesome.
I can't say anything more about the staff. They were fabulous. But some of the gong shows that were going on in that Surrey Memorial, as my email said, I don't know how these people do their job.
You know, he described a really tense and uncomfortable situation in the ER waiting room because people were being rude to staff, and part of it is that people are waiting so long to get care. Some people are sick, some people are in pain, people are stressed out. Everyone has medical anxiety when there's something wrong and you're in the ER. And so people are feeling this anxiety, the stress, they're waiting for so long, and then people are taking out that frustration on the staff that are doing what they can to get through people as fast as they can.
So what happened to Rob when he finally got to see a doctor?
Yeah, so by the time he finally got in, the doctor told him he probably should have been seen way earlier given the state of his shoulder.
And even the doctor, he says, you should have been to the front of the line. And I said, well, I would have appreciated that. They're just so busy. That's my bottom line comment. They are just so busy. They can't handle the volume.
So that was earlier this year. And then this month, his wife had a fall outside of their home. She injured her hip. They also went to the ER, and she ended up spending 2 days in a bed that was in the hallway because there was no room for it to go into. And he said it was just, very uncomfortable, having very little privacy when you're trying to rest and recover.
And you said you've also received emails from nurses and doctors?
Yeah, dozens of emails from doctors right across Canada, but many of them here in BC. And a lot of them were saying they wanted to show their support for Dr. Caitlin Stockton's lawsuit. They wanted to speak out about similar conditions and situations that they've experienced and seen in the ERs that they work at and the effect that it's having on their patients. But they said that they were scared to put their name to these stories because they don't really feel like they can speak publicly about it because they fear the consequences for their jobs. And I think that's what really made Dr. Caitlin Stockton's story so unique earlier this week, is to have a doctor speak out about what they're experiencing.
Thank you for bringing us these stories, Michelle.
Thank you.
That is Michelle Gassoub. She is a reporter with the CBC's investigative unit here in BC.